Good morning. This is Dr. Timothy Scott Beck here at Life Point Medical, and it's July the 25th of 2022. I'm going to give you my weekly update on what's going on here in the practice, in the community, in the country, and let you know what we're doing. So first of all, let's talk about the dreaded COVID-19. So I tried to do some reading on it this weekend, trying to get credible information about what's going on with it. It's definitely prevalent in the community now. I think there's a lot of controversy now on what actual measures you can take to mediate it. Okay, and we've tried a lot of them right over the last few years. I still think the most credible one is the using the hand sanitizer very liberally, using it a lot, is probably the most significant thing you can do. Wearing a mask. Theoretically, thought it was supposed to help, but I'm not sure it's that way. And even the vaccines, they say, are not working now. People are still getting this virus. The only thing I do want to do is reassure people it doesn't seem like it's as severe as the previous ones. And we've treated 10 or 20 people with it over the last couple of weeks. And I don't believe anybody's been to the hospital yet with it, or nobody's significantly sick from it. So certainly we want to take care of you if you've got it. We want to hear from you, and we have our protocol set up. We'll see you through telemedicine and kind of do hands off, make sure you're okay. Now, if you've got other symptoms like chest pain or severe shortness of breath, or if we think you might have pneumonia or anything like that, we're going to have to listen to you or see you, or send you to the emergency room. Okay, just remember, we just got to we're trying to be as safe as possible with whatever we do, while still not allowing you, still getting you taken care of. Like, we got to be safe, but we also have to make sure we're accessible to people, and that's what we're trying to work on. I have been prescribing the medical, the preferred medical medication for this called Paxlovid, and a lot of the pharmacies have it here in town. And we still do have the IV infusions if that is something that you're interested in. Okay, but we want to see you, and we want to evaluate you if you think you've got COVID. Okay, and we still have the drive-through. You can still get testing if you want done over there, and we can see you if we think you need to be seen in the drive-through. Okay, but that all needs to be coordinated with a visit. Okay, so let's talk about some other things. So it's July. It was a great weekend, I thought. It was beautiful, not a lot of rain. Okay, but it was hotter than blazes. Okay, so we want to watch our heat. Two things we want to worry about with heat are dehydration and then sunburn or sun poisoning. So first of all, with the hydration, you know the deal there. Drink plenty of water, add a little salt every once in a while just to make sure it holds on to you. And that's what I do when I work, is I drink as much as I can. And then as far as sunburn goes, we've got all these heavy metal sun blockers. I'm not as big a fan of them as I am just wearing regular clothes to protect your skin. And I know a lot of people, even a lot of these outdoor gear fitters, are getting more on that, where they cover your skin. And it's kind of interesting. I was looking at a picture of one of my great grandmothers the other day, and she she lived up here, and she had no skin exposed, nowhere. She had on long sleeves, and you could tell it was the summertime. And I was wondering if she knew something we didn't about all of that. It's pretty neat. But even in the sun, even in the heat, they still wore long sleeve shirts, and I think that was probably something they did to protect themselves from the sun, because they didn't have, way back then, they didn't have treatments for skin cancer like they do now, and a lot of times they would go untreated and be a menace to them. So just be careful out there, and make sure the heat don't get ahead of you with whatever you're doing. Okay, it's okay to take a break. All right, so medical thing I want to talk about today, low back pain. We see low back pain every day, every single day, probably since the time I've been open. I've had somebody come in with low back pain. So that is a common spot for people to have pain. So let's talk about how we handle it. First of all, we probably need to see you if you got low back pain. We need to figure out whether or not you've had any trauma related to it, because that always makes a difference. You want to figure out how often it's happening. If it's there all the time, it's not there all the time. And we want to know whether you've ever had surgeries. If is this something that just come on soon, recently, or has this been something that you've been dealing with the rest of your whole life? And what we'll do is we'll evaluate you and try to figure out what's going on. A lot of times people just have pain, inflammation, and spasm running in a circle in their back, and that just can be kicked off with the least minimal action, and it's incredibly painful. And if it's really, really, really painful, like you're like somebody stabbing me in the back, then you're having a muscle spasm, most likely, or you're having a nerve impingement, most likely. And both of those they're extremely sharp pain. The only thing with the spasm is it can go away quick, where the nerve impingement's not going to go away that fast. But we have different ways we can do it. We start with conservative treatment. Maybe we get an X-ray, make sure there's nothing huge going on there. We try non-steroidal anti-inflammatories or steroidal anti-inflammatories to try to settle it down. If that don't work, we've got other modalities like physical therapy. The physical therapists in this area are really good at treating backs. And they have other modalities like cupping and dry needling and stretching and stuff. And usually when I send people to physical therapy, I always send them there saying, hey, go there as a student, not as a patient. Go there as a student. You'll learn and look and see what they're doing, so you can continue to do these exercises at home, particularly if they provide you relief from your pain stuff. So if that don't work, then we can do injections, trigger point injections, steroid injections to look and see. And maybe we do an MRI if we can't get you better. And usually I'll collaborate with physical therapists to see, does this patient really need an MRI or something? And we'll look and see if there's something going on that needs to be surgically repaired. I don't recommend back surgery, but sometimes it's necessary, and I help people with it, and try to help them make the best decision as they possibly can when it comes to having surgery. And that's always the case. I always want to help people scrutinize whether surgery is appropriate or not based on what's going on with them. And last but not least, we got Place of Hope, North Georgia. We've got our annual picnic coming up September the 8th. We just had a board meeting last week, and it was extremely productive of what all the stuff we're doing here. And we're still absolutely amazed at the community support that we're getting and the support that you've been giving us. It's Place of Hope, North Georgia. And if you've not heard me talk about it before, we're about a month or two away from opening a emergency intake shelter here in Rabun County for these kids. And it's been quite the journey. We've been working on it now for a couple of years. We've got a full-time executive director working for us now, and she is out there right now working and collaborating with the local services, trying to help get people taken care of. But anyway, Place of Hope's doing good, and we really appreciate your support. Otherwise, I'm doing well, and I hope you are. And certainly if you're sick, we want to hear from you. 706-782-0016, or you can go to our website, drtspec.com, and ask for a visit. We do the same thing here every day, all day, and that's asking people what's wrong and how can we help you. Okay, so if you've got those questions and you need us, please give us a call, and we'll try to answer them for you and listen to what you're saying. Remember, we think listening is a great idea, and we try to our best here. But anyway, you have a great day, a great week, and call us if you need us. Thank you.